your name above all names. We thank you for this beautiful day. We thank you for the blessings that we have, the blessings that we are bestowed every day and every night. For waking up with a brand new beginning every day. For the loved ones that we hold close to our hearts. We thank you for your grace and mercy. We thank you for all that you do. And Father God, we come to you today and ask of guidance for our meeting as Health Education Human Service Committee members. Help us outline the priorities, the issues that need to be handled today, that need to be resolved for our people, for our students, our children, our elders, our employees of the great Navajo Nation. And Father God, I know that we are dealing with a great pandemic, with a virus that is deadly to many. And because of that, we have lost so many loved ones. Our hearts are still aching, Father God. But we know that you have a plan for each and every one of us, and that you'll help us regain our strength and to carry on for those that we have lost. And Father God, in our leadership position, we ask that you give us the guidance, the knowledge, and the clarity, and the patience to understand, to consult. And Father God, we ask that you help us with every issue, help us find a solution. We deal with many challenges every day, with even building the Navajo Nation infrastructure. We have these challenges, Father God. We are not perfect. So please, Father God, provide us with whatever need that we have. We ask that you guide us every day and keep our families safe. Whenever we travel on the roads, whenever we leave the houses, whenever we lay our heads down at night to rest, we ask that you send your guardian angels by the thousands to protect us from our enemies, to protect us from viruses, from bacteria, from cancer, from any illness that we don't want within our bodies. Father God, we ask that you guide us every day. And please, God Almighty, be with our people, our elders this winter season, our students who are struggling to make ends meet, to pay for their rent, to pay for their tuition and books, to feed themselves. Father God, I ask that you bring restoration and that you'll bring every need to each of our loved ones and those that are across the whole world. God, keep them safe for us. And God Almighty, we ask of this in your Son, Jesus Christ's name. Amen.
Okay, Bishop, thank you for that most gracious prayer. Committee members, do we have any announcements? If there are none, then let's go to recognizing guests and visiting officials.
Good morning, Honorable Delegate and Health Education Human Services Committee members. This is Brent Nelson with Department of Education joining on the call. And also we'll be waiting on to do our report on letter C. Thank you.
Good morning, Honorable Delegate and Health Education Human Services Committee. This is Jason Arvizo representing Navajo Technical University. Dr. Elmer Guy will probably be joining the conversation as well. Thank you.
Good morning, Chair Delegate. So this is Joy Thompson. I'm representing Diné College. I will be also joined by Vice President of Administration and Finance, Bo Lewis. Thank you for requesting our presence at this meeting.
Yat A. Bene, Honorable Chairman and Vice Chairman and other leadership under HES. This is Lita Scott, and I'm the Director of Community Health Services, and I'm also on the agenda to present. Thank you.
Good morning, Yat Eben Shinale, Honorable Daniel So, and the rest of the Health and Human Services Committee members. Yat Eben, this is Sally Pete from Winslow. I'm listening in, and 2 of our staff members will be presenting at a later time. Thank you.
Hello, my name's Sharon Jackson. I'm the nurse executive for the Winslow Indian Healthcare Center. So I'll be participating with the presentation with Lita Scott. Thank you.
Good morning. My name is
Good
Alfred
morning.
Yazipit. I'm the Public Information Officer for Winslow Indian Healthcare Center. I'll just be listening in also. Thank you very much.
Yeah, this is Wayne Claw with the Navajo Nursing Home, just listening in.
Good morning. This is Darlene Pino from Nntrc, Chapter Vice President. I'm listening in. Thank you.
Good morning, Chair and committee members. This is Michelle Boris, Legislative Analyst for Department of Health. I'm on the call.
Anyone else? If not, then Ms. Angelita Benali, could you review the proposed agenda with the committee, and we move forward to adopting the agenda?
Yes, Mr. Chair. I apologize. I received a call just from NHA in a little bit. You have your proposed agenda, the Health, Education, and Human Services Committee 24th Nomination Council regular meeting, January 12th, 2021. Presiding, the Honorable Daniel E. So, Chairperson, the Honorable Carl R. Slater as Vice Chairperson. The place is via telecommunications, Winter Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation, announcements. 2, recognize guests and visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals. November 17th, 2021, December 8th, 2021, December 15th, 2021, and December 22nd, 2021. 5, receive reports. A is an update by the Navajo Department of Health. It's regarding the pandemic response. The presenters are Dr. Jill Jim, Executive Director for the Navajo Department of Health. B is a report by the Winslow Indian Healthcare Center Incorporated regarding the nursing shortages, and also the referencing the Winslow Indian Health Care Center Board Resolution. Presenters are Lita Ann Scott, FNP Director, Community Health Services, and Noria Bryce, DNP Chief Nurse Executive. C is a report regarding legislation number 0257-21. And it's regarding primarily regarding broadband. And the location of this legislation is that it is assigned to the Navajo Committee and the Navajo Nation Council. And the Navajo Committee has had 2 work sessions on this particular legislation. And there's going to be recommended proposed amendments to the legislation presented. Presenters are Brent Nelson with Doty, Dr. Elmer Guy President of Navajo Technical University, and Dr. Charles Russell, President, Dene College. Also available for presentation will be Chief Legislative Counsel Dana Bobroff and Chad Abeda, Legislative Counsel. And also invited is Christopher Vicente, Director of Department of Telecommunications. 6 old business, none. 7 new business. A is legislation number 0266-21. 8, close a meeting, announcements and adjournment. Mr. Chair.
Thank you. Committee members? Committee members, we certainly have the latitude to, in view of the aspects of multitasking, I think we could pare down the proposed agenda and we could ask for a special meeting next week to basically look at deferring some of these items. Number one, if I could ask the committee to basically listen to the Department of Health presentation, as well as the presentation on 0257-21 as the only 2 items. Ms. Benali, did you also include in there the legislation regarding the carryover of annual leave? The one that's sponsored by Honorable Mark Freeland.
Yes, Mr. Chair, that's legislation 0266-21.
Could we, again, committee members, defer that to Monday or Tuesday, depending on the committee's schedule? I know on the 18th, the New Mexico legislature opens, and the New Mexico delegates have received an invitation from Speaker Brian Egoff to be in attendance, much like what is going on at the Arizona legislature today. So with that, committee members, if we could pare it down just to these 2 items, we'll shoot for a special meeting on the 17th.
Chair, this is Delegate Paul Begay.
Mr. Chair.
I will go ahead and.
Mr. Chair.
Ms. Benali, yes.
Yeah, Mr. Chair and members of the Health, Education and Human Services Committee. The 17th is a holiday, Martin Luther King.
Okay, and Tuesday the 18th, and the next regular meeting is the 19th, right?
That's correct. These items could go on the agenda for the 19th.
So yes, the reason I'm wanting to include the broadband presentation is we certainly want to craft an amendment that will impact how we proceed. If we could, committee members, just pare it down to the Department of Health and the broadband, and we'll defer the rest to the 19th. And on the 20th, then Nobby would be addressing the agenda items for the winter session. of the Navajo Nation Council committee members. Honorable Paul Begay.
Yes, thank you, Chair. I would like to go ahead and motion for the recommended deferment and also go with what Chair has outlined. That would be my motion. Thank you.
Thank you, Chair. Chair recognizes the motion.
Diaz, I will second that.
Thank you, Supervisor. We have a motion and a second to amend the agenda to include two reports. Report from Department of Health and from Doty and other parties regarding legislation 0257-21. Mr. Mose, roll call vote, please.
Yes, sir. Honorable Paul Begay Jr.
Honorable Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Honorable Charlene So. Honorable Charlene
I vote green.
So. Honorable Charlene So votes green. Honorable Edison J. Wanika.
Green.
Honorable Edison J. Wanika votes green. Honorable Carl Russell Slater. Carry a vote of 4 in favor, 0 opposed.
Thank you, committee members. I appreciate the considerations.
Chair, sorry for interrupting. Honorable Carl Russell Slater just texted me, he votes green on the agenda.
Okay, Augustine, let the record show a vote of 5 in favor, 0 opposed, and the chair not voting. Yeah. Ms. Sally Pete and colleagues of Winslow Indian Healthcare Center, please, we respect your time, and certainly we're in a situation that I didn't really plan for thinking that we go full blast, but didn't realize that the other aspects of the Arizona State Legislature's proceedings. So with that, I express appreciation for your attendance, and I sincerely apologize for having to defer your presentation to Wednesday, January 19th. And certainly ask for your understanding. So, Priscilla, let's proceed. With that, the adopted agenda, we will go now to review and adopting the journals. Item number 4. Committee members, what's the wishes? Mr. Mose, Ms. Benali, could you review the journals and that particular agenda item?
Chair, this is Leonard. I emailed them out yesterday morning around 8:04 to all the HES members.
So a motion to accept the journals. Thank you.
Thank you, Chair. I recognize the motion by Honorable Paul Begay to adopt the journals as per the agenda item. Do I hear a second?
Second that motion, Solana.
Yes, I have a motion and a second. Do we have discussion? Going once. Twice. 3 times. Mr. Mose, a vote, please. Roll call vote.
Yes, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Zelona. Honorable Pernell Zelona.
Votes green.
Honorable Pernell Zelona votes green. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Honorable Charlene So.
Green.
Honorable Charlene So votes green. Honorable Edison J. Wanika.
Green.
Honorable Edison J. Wanika votes green. Honorable Carl Russell Slater. Carry a vote of 4 in favor, 0 opposed.
Thank you, committee members. Vote of 4 in favor, 0 opposed. The chair not voting. Let's move on to item 5, receiving report. Miss Angelita Benali review the item 5A with the committee.
Okay, Mr. Chair and members of the Health, Education, and Human Services Committee, 5A is an update by the Navajo Department of Health regarding the NDOH pandemic response. The presenter is Dr. Jill Jim, the Executive Director for the Navajo Department of Health. Mr. Chair.
Dr. Jill Jim.
Chair, this is Leonard. Sorry for interrupting. I just got a text from Honorable Vice Chair Slater. He votes green on the journals. Be 5-0.
Okay, so let the record, I did not recognize another motion since the last vote, so Honorable Vice Chair Slater's vote will be included in adopting the journal. Let the record show a vote of 5 in favor, 0 opposed, and the chair not voting. If Dr. Jill Jim is not available, Miss Angelita Benali, who else was listed to do the presentation?
Chair Sanaa, this is Dr. Jim.
Oh, okay. Yeah, Deja. Thank you for joining the committee, and we now have teleconference floor to present your report.
Okay, Sanaa, thank you again for this opportunity. I wanted to kind of just go over some of the Department of Health's progress to Ashbila. I know I did an update before in a work session. If I can do an NDOH update and a pandemic response together.
You certainly can. Thank you.
I'm going to share my screen if that's okay. Angelita and Chair Sanaa, am I able to do that?
Yes, it's available, Mr. Chair.
Go ahead.
Okay. Do you guys see my screen now?
Yes, we can see it.
Okay. Well, thank you everyone. For those on the call, I am Dr. Jill Jim. I am the Executive Director for the Navajo Department of Health, and thank you for including me on the agenda today. I know I had done an update regarding the department a while back ago, and today I wanted to kind of just share where we're at in the fourth year of this administration as we're continuing to respond to the pandemic. So, and also just wanted to say thank you to the other HES committees that are on the call, committee members on the call, and guests as well. And so on the Department of Health is actually authorized by the Title II for Navajo amending or the Navajo Nation Council Section 1601, and that was enacted in 2014. And I'm just recalling how we presented the first year around when we were doing presentations about our department. And I feel like I'm going back to that as remembering what we were planning to do here, and I was planning to do with my team here at the department. And one of that is just the public health accreditation. I think this is still should remain a focus for the department, not only this year, but next year going forward, because this allows us to address what the pandemic is all about, public health infrastructure. And that's what has resulted from this pandemic, is that there is lack of or limited public health infrastructure nationwide, not only here on the Navajo Nation, but the state and also nationally. But no one didn't know how we would respond to the pandemic. So when we look at public health, this is sort of the accreditation that we've been looking at, and before my time as well in the last administration, I think the team has been trying to accomplish this. So when we hear language about public health infrastructure, I feel like it is the very sovereign right of the tribes to have this capability. It doesn't lie within the Indian Health Service, or it doesn't lie within hospitals to some extent. Public health is the outreach that our programs are doing out in the community right now, and it relates to not only the schools, the tribal programs or businesses. That's what public health is. And I think that we're missing that point sometimes when we're talking about public health infrastructure, that the tribe has that responsibility. And that's when we say, like, what is a state-like health department? And we view ourselves the same way like we do this as a state where they have a state health department that oversees everybody around public health, and then they have hospitals under that too, and they serve a different function. And I think that's where we're needing to strengthen the department in relation to how we work with health facilities and Indian Health Service. And I think we should try to avoid overlapping these responsibilities and better understand where does the tribe lie in public health. And I believe that it lies within the Department of Health. And so getting an accreditation will have us achieve that certain responsibility and capacity that we need to under the department, because we're authorized to oversee the health of the Navajo people. So I like this this effort that the team has been doing and has been trying to achieve, and I think eventually we will. And I just wanted to remind the HES committee members that this is what is a primary goal, I think, that we're still trying to work on, and just to remind us all of what the Department of Health's goal is, and that's one of them. We also have a master plan of operation, and we have the Office of the Executive Director. We don't have all those positions filled just because I think there would need to be sort of a restructure to that. When the organizational chart was presented at the time, there isn't actually enough funding to cover all of those positions. So as I slowly am trying to fill positions that are needed, one of that is the 3 divisions. On number 3 is that we have a division of aging and long-term care support, where Ms. Valerie Jones is a health services administrator. We also have a division of behavioral and mental health services that Dr. Michelle Brancer is a health services administrator. And we also are trying to fill the division of public health services. Right now I have delegated Ms. Kimberly Gazi as the health services administrator for the executive director's office to oversee those programs. And so that's the structure that we're authorized to function under. And And this is what we're working with. And so I hope in the future, maybe this year, we can try to relook at this organizational structure, because I know there are some programs that are moving around, like uranium workers' compensation. I think we're also going to relocate, and there are other programs that we need to consider as well. A lot of the responsibilities that we have is to basically what we're authorized to do is evaluate, regulate, enforce, and coordinate health codes. So we're working on that. And then we're also trying to work on directing health services as approved and authorized by the Navajo Nation Council. So we work with contracted funds under IHS or other dollars. And then C is also we look at operating information to collecting, managing, controlling, protecting data. And I think we've been doing that during this pandemic. We provide epidemiology, surveillance, research, and disease investigation. So we're enforcing or we're implementing those responsibilities. And D is that we don't have still a process for the providing federal and state non-procurement agreements as well. So we're working on that. It hasn't been fully implemented, but those are the things that we ought to work on. Developing comprehensive health codes. We already have some health codes under the Office of Environmental Health, but we don't have, we do implement, and I think that should have been a work in progress. But we don't have overall health codes that I think need to be updated. So that's still, that should be work in progress. We also help and encourage lobbying for advocacy, maintaining government-to-government relationships at state, local, and federal governments. And I think through the pandemic, we've done that a lot, advocating for resources and trying to advocate for ongoing testing, vaccines, and medical staffing and whatnot that we've been challenged with through the pandemic. So I know that has been going. Also, the establishment of the Medicaid agency, we have not implemented that. I did ask for unmet needs funding for that for this last fiscal year, but that was not approved. So I still have to try to figure out how to support that particular responsibility. And also the establishing a structure and system and form of assistance for the practice and retention of traditional medicine. And I think we'll continue to work on that and looking at a holistic healthcare through consultation. We are looking at some of these through the FEMA response. Has a FEMA crisis counseling grant that sort of fulfills this purpose to some extent of working with traditional medicine. So we have started some of these connections, but there isn't a whole team dedicated to that as well. Also regulating the health and human and emergency, non-emergency medical transportation. I believe that this one would probably need to be revisited this year to relook at the legislation. I really need staffing to support this particular function full time. I did a request for an unmet needs, and that was not that was not included in the fiscal year 2022 budget. But we are offering some enforcement, but I think future funding needs to be allocated to that specific authority as well. The next steps, I think, for the department is to implement the plan of operation and also this achieving what I mentioned earlier, a state-like health department. Also addressing the NAHTA plan goals that's under this this administration, looking at possibly that early childhood and senior center reorganization. I think that's been sort of the goal, is the integration of that. We have not started work on that, but I think that would need to be discussed also with the ARPA funds that are being diminished right now. With I know there's going to be a council discussion, and there was funding that was going to support the detox to transitional housing and trauma-informed care sort of information through the ARPA dollars, but I don't know if that's the case. So if that's not the case anymore, I really would need to seek additional funding. And we do have Indian Health Service funding that through our contract to support this, but I'm not sure if it will support construction. So that we have to reassess now that I think the hardship resolution was signed. into law, and that will impact some of the available ARPA dollars. And also, I think what we're looking at, as Ms. Jones is on the call today, Arizona, New Mexico elder appropriation. I think this relates to just trying to look at seniors seniors and elders in their communities to receive the best care that they can, and how do we work with our agreements and legislators at the state level to move that forward. So that will be part of the effort in this last couple of months. And then another thing that passes the action plan, which focuses on Division of Public Safety and other divisions to incorporate this. I think behavioral health is integrated or is a partner in this, looking at suicide prevention and other behavioral strategies that we need to address around reducing substance use or suicide as well. So those are our steps. And then our ongoing steps that we continue to do is respond to the pandemic. And we're still in a major disaster declaration. So I think there needs to be a reminder just to everyone that we're still in a major disaster declaration. And that means that most of our funding or most of our expenses that are possibly general funds can be, and other ways of getting FEMA reimbursement can still be done in this declaration. So my message to the HES is that I think just to encourage not only the departments, but also other divisions and the chapters that we are still in a major disaster declaration. We also still operate on a weekly basis, a unified command group. We met this morning, and yesterday we issued out 2 public health orders. Public Health Order 2022-01 really relates to reminding everyone that we're still in a safer at home status for everyone, so only travel as you need it. And then we also incorporated a recommendation for traveling during this Omicron surge, and that means that if you're fully vaccinated or have a booster, make sure you delay travel until you do that, or either you delay your travel only if it's necessary. Test if you need to before and after you travel. And also just if you're sick, if you're seeking medical care or if you're under quarantine, just to stay home. But seeking medical care is probably still recommended. And then the second public health order, 2022-02, is related to declaring the schools in a red status, and meaning that under the COVID-19 school framework, the one thing that changes is that they all have to do all the mitigation strategies like wearing masks indoors and outdoors, as well as making sure there's testing and reporting to the portal, and making sure they're informing the public about the number of cases that are at their school. And then also making sure there's physical distancing, more aggressive physical distancing, and also encouraging schools to also go into hybrid or virtual learning at the maximum extent possible that they can do. We still have a 15-person limit regarding any gathering that is non-classroom instructional, like orientations or community events. And then the one thing that we added to the public health order for schools is there should be only a 25% sports attendance right now. So if they're based on their maximum occupancy, so if a gymnasium holds 100 people, that only 25 of those seats should be allowed for parents or community members to come in. We also will issue out a guideline for the particular sports event too. And one thing that we are encouraging schools to really consider is team exposures, and that's where we're not getting in-school transmission, but what we're seeing is basketball teams or other sorts of team events where the team members are transmitting within the team. So, and by going off the reservation as well. So those are some guidelines that we put in place for schools, and they're in effect as of today. The public health order number 2022-01 is in effect yesterday. And in addition, we'll be issuing out a health advisory on the isolation and quarantine guidelines. And so just wanted to remind individuals under the Health Command Operations Center, when CDC issued out their 5-day where they can end isolation based on testing or symptoms, those have we're not in total agreement with CDC's recommendations. So the health advisory will be issued out to look at isolation and quarantine for the general public. And today we agreed that possibly we will include schools in that same guideline because there's so much nuances in how CDC has changed their recommendations, and we are making decisions on what is best for Navajo. And so we're looking at the isolation and quarantine a little bit differently. So we just want the general public to know that what is posted or what is on media regarding CDC's isolation and quarantine is not the same as on Navajo Nation. So we do have different protocols because we feel like that people have, the reason why we have different protocols is because we feel like there needs to be they need to fully implement their isolation of 10 days versus 5 days if certain things are not met, where CDC gives the option for people to actually make their own decision. So we just want to make sure that people are fully meeting our recommendations, either in possibly in schools and also in the general public will have that same recommendation. We did inform the schools yesterday for at the school leadership meeting that Dodie does every week to inform them of the public health emergency orders and the guidelines that will be issued. So that's the function of the Unified Command Group. We work with Indian Health Service, tribal health organizations, and external partners to come to these decisions, and we approve those, and those are in place and as will be in effect as of yesterday and today as well. So I just want to let you know those are some previous current work or recent work that we're doing. We also are still overseeing, and the Department of Health, meaning myself, DCD, and DEM are working on FEMA reimbursement. I know that I think with DEM there is staffing changes, so we're continuing to work with FEMA on our end. And so there's, it's not just one division that's working on this, but I would hope to just convey that I know with the Department of Health, we have worked on getting reimbursements for the general funds that we received or at the beginning of the pandemic. Those are finally being obligated back to the Navajo Nation. As far as other reimbursements for the Navajo Nation or other divisions that will lie under DEM and DCD, they're working on their own reimbursements. But I know for DOH, we're trying to get as much money back from those general funds that were given to us early on. And then they all have to pass certain eligibility criteria, because if they don't have certain documentation, that it does limit their reimbursement chances of getting anything back as well. And we're also going to continue to advocate for ongoing funding as necessary, I guess, and that means from different funding pools. We don't know how long this pandemic's going to be. It could be past this administration's timeframe, and I hope that we look at what kind of funding can help support some of the community mitigation strategies. I know that some things that we are not doing right now is offering isolation or quarantine for hotels, and those were effective in the second surge, but due to the high cost of funding and the need for other funding sources and collaboration with our health partners, which they also received COVID-19 and also CARES Act and ARPA dollars. I think the shared cost also that and so so ongoing funding, I think, is definitely needed. And as we're going into the conversations of how do we continue to support COVID, I think that's a question not only to lawmakers, but also the entire Navajo Nation and Indian Health Service, and the federal responsibility to give us as much funding as we need to address the pandemic. And so I just want to just continue to reiterate that funding will always be needed, and how we get it really will depend on the support that we get. And I know there's still staffing shortages that we're going to talk about that has been addressed. There isn't just enough funding. There's not enough people, and our hospitals are outdated, and there's not enough beds. I mean, these are just issues before the pandemic, and how we resolve some of these are short term, but I think there can be long-term solutions. And one of that is how our health care system was very vulnerable during this time. But you know what? We all did the best that we could, and we are really doing okay right now in the meantime, meaning that we're not seeing all of the beds being filled due to the Omicron variant being here on the reservation. Omicron has been detected first in the Utah healthcare system, and now we do an ongoing surveillance report, and there have been additional Omicron detected across the Navajo Nation, including Central Agency, Western Agency, and part of maybe Northern Agency. So it's been detected more so, and we do weekly surveillance on that. So there has been more than one detected, but we're not issuing out a separate press release on that. But it's in our surveillance report that we report on our webpage, and also we have an internal reporting system on that. So as we continue to look at the pandemic, I think funding is very important, in the support that we get, and what is it that we actually need. And when I really talk about infrastructure, and that means staffing and resources, how do we look at the tribal, how do we look at the tribal government staffing? Like the Navajo Health Command operation has been overseeing not only all of the people on the Navajo Nation, and we make decisions to help patients in hospitals, in businesses, in the tribal government, all in schools. So the Health Command has been overseeing a lot of these, and as the pandemic is still ongoing, we need to figure out how do we enhance the capacity of some of these entities, such as schools. How do we encourage schools to allocate more funding and resources so they can do their own testing, so they can do their own contact tracing, so they can buy their own testing? And so there are resources out there that they're receiving, but to me, I have not seen a lot of that, and we're still trying to figure out, well, there has been funding that has been approved through congressional appropriations, but how do we see here? And then the states are still offering pool testing for the Navajo Nation. So, and then we're also looking at tribal government. How do we look at the health and well-being of tribal employees? Do we have an employee health office? How can we build that? I mean, it's not really the Department of Health. I feel like our responsibility is to the entire Navajo Nation, but we have an executive branch, a legislative branch, and a judicial branch. How do we build their capacity to buy testing, to look at contact tracing, to look at medical advice and developing policies? So I think there's sort of that infrastructure that's still needed across the entire Navajo Nation. And even with our health facilities, sometimes they share internally how to develop policies on how we're responding to the pandemic. So there is a unified command group where we oversee the entire Navajo Nation in regards to the pandemic under the Department of Health's response. But as the pandemic is prolonging, how do we build the capacity of chapters to operate? And I know we've been talking about, Honorable Juanita has always brought up the whole hazard plan and disaster plan. And I feel like that's part of the division or Department of Emergency Management. How can DOH support them to fulfill that plan before the administration? So those are things I think there's still that could be still achieved in the remaining months of this administration. And I just wanted to do a quick update about just general infrastructure, about our capacity to be able to transport items too. And we need updated warehouse vehicles, box carts and things like that, and also staffing to respond and package food boxes. And So it's an ongoing effort, but I hope that somewhere along the way that we do, if there's a pandemic that happens again, that we have updated warehouses or an emergency management building or something like that for the Navajo Nation to continue to respond. And I hope we never end up in a pandemic again. But I think those are the support that would definitely help not only the Department of Health, but the Navajo Nation's response to natural disasters and also future public health pandemics as well. So I just want to thank you for the time, and I'll end my report there, Shache, and the rest of the HES committees.
Oh, yeah, last days, Dr. Jill Jim, committee members, do I hear a motion to accept the report? Committee members? Mr. Mose, do we still have quorum?
Yes, sir. I still see yourself, Honorable Paul Begay, Honorable Halona, and Honorable Charlene So are still online. On the call, those three.
We still have quorum, committee members?
Yeah, total four members, sir.
Thank you, Mr. Mose.
Sir.
Sounds like I'm the only one that's not in Phoenix. So I abided by the new
correct.
health order. So I abided by the new health order, stay at home. Oh, but all the colleagues are vaccinated. And I think most of them have the booster. Committee members, another call. Motion to accept the report.
Chair, so Delegate Paul Begay motions to accept the report. Also to let you know all the 5 other HESI members are in Phoenix, Arizona. We are now meeting with Council Legislators. Thank you.
Akushila Shache, thank you for that update. Motion by Honorable Paul Begay is recognized. committee members. Second that. Second by Honorable Pernell Salona. Second on that, Chair. Okay. The second is recognized. Certainly apologize to presenters and folks on the call. Try to maintain focus on the presentation. And if need be, we can more than likely after the winter session, we can follow up with the discussions on this particular item that Dr. Jill Jim presented today. Motion and second to accept the report. I don't think there's any questions or comments. Mr. Mose, roll call vote.
Yes, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Hello, that's green.
Pernell Halona votes green. Honorable Carl Russell Slater. Honorable Carl Russell Slater. Honorable Charlene So.
Green.
Honorable Charlene So votes green. Honorable Edison J. Wanika. Honorable Edison J. Wanika. Honorable Carl Russell Slater. Chair voted 3 in favor, 0 opposed.
Thank you, Mr. Mose. Let the record show a vote of 3 in favor, 0 opposed, and the chair not voting. Let's go on to item 5B. Ms. Angelita Benali, can you review the that report matter with the committee?
Mr. Chair and members of the Health, Education, and Human Services Committee, B is a report regarding legislation number 0257-21, an action relating to the Navajo Committee and Navajo Nation Council, allocating $1,166,003,000 to the Navajo Nation Physical Recovery Funds, approving the Navajo Nation Physical Recovery Funds expenditure plans for water, wastewater projects, broadband projects, home electricity connection projects, housing and housing renovation projects, bathroom addition projects, and hardship assistance. The location of this legislation 0259-21 is that it is assigned to the Navajo Committee and the Navajo Nation Council. The Navajo Committee has had 2 work sessions regarding legislation 0257-21. The first work session was held on December 1st and 2nd, 2021, and the second work session was held on December 16th and 17th, 2021. And the discussion for this report is to recommend proposed amendments to legislation number 0257-21. Presenters are Brent Nelson, Systems and Program Manager with the Department of Diné Education, Dr. Elmer Guy, President with the Navajo Technical University. However, Jason Arvizo is on the line on behalf of NTU. Also presenting is Dr. Charles Russell, President of Diné College. And also on the line is Joy from Diné College. Available for the presentation are Ms. Dana Barbara, Chief Legislative Counsel, Chad Abeda, Legislative Counsel, and invited was Christopher Vicente, Director for the Department of Telecommunications. Mr. Chair.
Thank you, Ms. Benali. let's have Mr. Brent Nelson have the teleconference floor.
Thank you again, Chair Mr. Dale So, and also the Health, Education, Human Services Committee. Good morning. Again, thank you for including Dodie, NTU, Navajo Technical University, the Net College, in today's discussion. On behalf of the Navajo Nation Department of Education, Superintendent Harold McGay, and then also Assistant Superintendent Patricia Ghani, we want to express our gratitude to Health, Education, and Human Services Committee for the ongoing interest and the leadership on our addressing our connectivity challenges here on Navajo Nation. Again, my name is Brent Nelson. And I would like to also introduce a partner of ours that's also on the call, Mr. Joe Carrillo, who's been helping us develop the Navajo Nation Middle Mile Broadband Plan that we've been presenting over the past year to year and a half to not only the subcommittees of the council, but also to Navajo Nation Council as a whole, to address a lot of our broadband efforts here on Navajo. So again, I just wanted to make that proper introduction. And then also, you know, from the Department of Education and my role, you know, I've been at the forefront of the Navajo Nation's efforts to obtain affordable broadband access to our schools and chapter houses and homes. So as many of you know, the pandemic has made daily life and distance learning nearly impossible for thousands of our school children and teachers, parents and grandparents out there on Navajo Nation. And one of the biggest challenges standing in our way of obtaining broadband services, both lack of affordability and the lack of redundant and resilient infrastructure to make that last mile high capacity broadband access attainable for our school kids who cannot interact from their homes with their teachers or friends with these two key points that I had presented. And you know, the Navajo Nation has struggled with these challenges, of course, for decades. And despite the fact that we've been experiencing a historic public health crisis that has threatened the survival and basic existence of our culture and our families, you know, we are also facing increased limitations on our ability to remain connected during mandatory quarantine periods. And again, with this new virus outbreak, you know, I think the proposes to increase virtual learning. So again, that's one of the obstacles that we deal with day in and day out. I also wanted to introduce our amendments. You know, here shortly we'll see some of the developed amendments proposal to our broadband, to the broadband infrastructure, to address infrastructure deployment and adoption challenges that we are struggling to inhere across Navajo Nation. But again, one of the biggest issues is the lack of middle mile broadband access to serve as connections to our backbone to all last mile network services. And I think one of the advocacy and one of the things that has been presented to the Department of Education is really affordability, and then also having that option of competitiveness. You know, where we want to build equity. We want to have resources and affordability be made to our communities and our students. I think today we all are aware we are paying a premium for connectivity that's not even sufficient, and that remains to be one of the main primary concerns, not only in our Head Start early childhood sections, but also in our K-12 environments. We still have areas across Navajo Nation that are unserved and underserved. And it seems like we still need to address solutions for those students out there, along with in encouraging and bringing more subsidy programs. I know that we've all heard of the EBB program that had provided some subsidies to our tribal communities across the nation here. Those type of services, they still need to be supported and expanded on. But there's a lot of other information that is still needed to make those sound decisions and those sound advocacy. So just wanted to provide my introduction from Department of Education, and also would like to turn the time over to Jason Arvizo, who is with the Navajo Technical University, to provide some of his input from the secondary institutions here on Navajo. And following that, Joy Thompson with the Net College. So Jason, if I can turn the time over to you to provide your input from Navajo Technical University. Thank you, sir.
Thank you, Mr.
Thank you, Mr. Nelson, for the overview, and then to Mr. Jason Arvizo, you have the teleconference floor.
Thank you, Mr. Chair, Honorable Delegate. So I do believe Dr. Elmer Guy has joined the conversation, and I'd like to possibly allow him to go ahead and begin the conversation regarding Navajo Technical University's position in regards to this really important matter regarding legislation 0257-21. Dr. Guy, are you on the call, or would you like me to proceed?
Good morning, Honorable Daniel So and members of the Health, Education, Human Services Committee. I'm in an area that has poor connectivity. I would like Mr. Arvizo to proceed, but I just wanted to say very briefly, the legislation that we're talking about, there's nothing in it for education. And we need to make sure education is part of this broadband effort. So with that, I'll say that much, and then have Mr. Arvizo make a report. Thank you.
Thank you, Dr. Guy. That we'll have it. We'll make it known to the rest of the Navajo committee. Thank you. Mr. Arvizo, you may continue.
Well, thank you, Mr. Chair and members of the Health, Education, Human Services Committee. Thank you for taking the time to listen, to the comments provided to you from education. Education is very important across Navajo. We serve as higher education. We serve all 5 agencies of the Navajo Nation, and an environment that supports that development is very important to how we are looking to develop well into the future. We see the current legislation, to reiterate or restate Dr. Guy's comments, the lack of the current legislation neglecting higher education or education perspective is very concerning. We've at Navajo Technical University, we've grown to really develop our own capacity to serve our campuses in Crown Point as well as in Chunli, bringing to those locations specialized networks that are afforded to education. Research and education resources that can be then provided not just to higher education, but to education across Navajo, serving K through 20. We see NTUA, their expertise lying within, water, electricity, and sewer, but yet they have an entity that represents them when it comes to broadband. There are existing infrastructures across Navajo, and we would like to see a legislation or funding earmarked towards projects that actually are looking to enhance infrastructure across Navajo, not necessarily just looking to afford and build assets specific to NTUA. We see that benefit helping the nation develop its own plan and making sure that the developments regarding the broadband is addressing the nation's plan as opposed to a plan specifically provided by NTUA. We've been meeting as an education consortium, more or less. We've been having discussions with the Department of Dene Education, as well as Dene College, regarding how we see and how we would like to see education addressed within the legislation. There has been, proven relationships with existing carriers that helps to address costs and the ability to deploy into communities in and on the reservation. And the ETCs, for the most part, have their own subscribers, have their own communities they serve, and we're just looking for an opportunity to see how the dollars can be then afforded to just enhancing that environment across Navajo. And I'll go ahead and end there, and I'll allow Ms. Joy Thompson, who's representing Dene College, to comment. Thank you.
Thank you, Mr. Arvizo. Ms. Joy Thompson.
Good morning. Thank you, Mr. Chair, and the rest of the HESI committee members. I really appreciate the time that you're taking to listen to these concerns. As you know, and I really appreciate that the council has recognized broadband situation enough to allocate $145 million to this effort. In looking at the legislation, we see that 70% of that broadband amount is allocated to NTUA, and the rest is distributed to other efforts. I wanted to just place a thought in the mind of the delegates that we need to look at broadband differently on Navajo, and that this is exclusive funding opportunity gives us the ability to do some planning and do a more comprehensive solution. I believe that if we were able to bring all of the technology leadership together and on Navajo, we could come up with a plan that would really solve some of the issues that our students have experienced over the past 2 years in connecting. We know we experience firsthand, even the adults that are attending our institutions, they have experienced issues and experienced problems, and it's very frustrating for them to continue with their higher education, experiencing those issues. One of the things that we need to really look at is some long-term solutions for the Navajo Nation, because this funding will be initial at the time, but there is a lot of funding that is coming. And we feel that if there was some level of planning that was done, that that would be the best use of that funding. We are concerned about the legislation as well because of the oversight. Right now, NTUA is not regulated by the Nntrc, and we wanted to emphasize that Nntrc, the Financial Recovery Funding Office, and NNDIT need to be involved in some of this oversight and give more direction to be able to evaluate and select and administrate these projects. If you look at the proposal, the funding, the actual construction of any of these projects does not start until 2025. And with a more collective effort with all of the ETCs, that some of that construction can start much sooner, and that some of this relief will begin to happen more immediately. The more that collaboration is done, the greater an area will be given the proper attention. We also see that NTUA, in the way the legislation is written, it shows that there is other carrier section that is being directed by NTUA. However, NTUA Wireless is an ETC and would also compete for those dollars, and we feel like that is a conflict of interest for NTUA. So we would like to have that section reviewed to better distribute those dollars. And of course, we have to emphasize and we reiterate the level of competition that NTUA they are not providing rates that are affordable, and they're not comparable to the rates that other institutions or other families receive off the reservation. And we need to get as close as possible to those rates with the delivery and the performance that is needed for individuals to sustain a connection to attend classes and so on. And so in doing so, we believe that competition, and we believe that the collective effort is going to be the best option. Overall, in the beginning, we've been talking to some of our partners who are ETCs, and when the first NTIA grant was announced, they collectively looked at the areas, the mapping of the unserved and underserved, and they set out a plan to tackle those areas. And that is the way their projects were laid out. And we need to see some sort of effort in that same way developed. And we feel that the broadband office can also be developed using some of these monies to be able to manage some of this and be able to continue down the road to get all of the unserved and underserved connections in the long run. So that is my introduction, and I'd like to go ahead and turn it back over to Mr. Nelson.
Thank you, Ms. Thompson. Who is the next presenter?
Chair, so good. Morning again. This is Brent from Department of Education. And thank you. I think we'll go ahead and continue from Dodi's standpoint here. As mentioned earlier, I do have a colleague, or not a colleague, but a partner that we have engaged with by the name of Joe Carrillo, who's also on the line, that's going to help us, help me provide some details to our legislation of amendments from the three education entities, Dodi, Dennett College, and NTU, on some of the findings that Jason and Joy had shared with you, and really go into details of that, our proposed legislation amendments, and then possibly create some discussions after that and answer some questions. So appreciate the time again, Chair So, and then also with the Health Education Human Services Committee. Joe, or Chair So, can we do a screen share, or are we allowed to present?
Yes, go ahead and be sure and share the PowerPoint with Ms. Angelita Benali so she can email it to the committee members.
Sure, sure thing. Joe?
Chair, this is Ms. Bobroff. Can I ask a question?
Yes, you certainly can. Good morning, Ms. Barbara.
Good morning.
Joining the call.
Thank you, and I apologize for interrupting the presentations, but if we're working on amendments, which my understanding that's the purpose here, one of the things, and I've told the council many times, the public should be aware of it, particularly those entities that are requesting funding, and under CJY 4121, which established the FRF fund for the nation, there that legislation required the Budget and Finance Committee to put forth a application proposal process. I know that this has been explained numerous times to the executive branch, and so necessary is that application expenditure plan proposal to be reviewed by the Department of Justice for eligibility. And so not only, so the information to do amendments will be an expenditure plan deemed eligible from DOJ. I'm presuming that the Department of Education already has one that's gone through that. So that will be real key to me being able to draft amendments. Thank you, Chair. And so, excuse me, Department of Education, if you can send that to me, that will get us off on the right foot. Thank you, Chair.
Chair, this is Doug Slater.
Okay, thank you, Ms. Bobroff. Cecilia, Vice Chair Slater, you have the teleconference floor.
Thank you very much. My thought was that we would do the presentation today and then convene a meeting between the ARPA office, so Mr. Botero, and then Dana, to write out that language for a new proposal. And we'd keep much of the same proposal, but make some of these edits. So that was the theory it's operating. I just wanted to get, a public discussion and this on the record to express, these concerns. So I think that's the theory that I'm operating under right now. And I really would like to support some of these suggested ideas. But it wouldn't be under the Department of Education, it would be under the ARPA Broadband Office.
Yeah, Tig. Good morning. This is Joe Corella speaking in support of.
Yeah.
I apologize.
Just hang on. Thank you for providing guidance to the committee, Honorable Vice Chair Slater. Again, if we could, an aspect I'm looking for is some draft language. And then even the thought, as Honorable Vice Chair Slater and I had talked about, the installation of a, if a lot of the money continues to NTUA, then a public utility regulatory commission is another aspect that we had thought about and discussed. So those are some thoughts that we'll go proceed. Thank you, Ms. Bobroff. Thank you, Vice Chair Slater, Otto. Mr. Carrilla, you have the teleconference floor.
Chairman So and honorable delegates on the Health, Education, and Human Services Committee. I will share my screen. I have two documents. The first document is jointly authored by the three education entities, Doty, Diné College, and Navajo Technical University. And this, I want to address first Ms. Bobroff's comments. We all are well aware of the requirements for expenditure plans and proposed projects that need to be approved for feasibility and appropriate use of ARP funds. We are not making any specific project requests today. I do believe that Honorable Delegate Slater's comment is appropriate, that there should be a working session afterwards. We are framing a discussion for possible amendment consideration by this committee and ultimately by NABI if it makes it that far. And Ms. Bobroff, we would ask for Office of Legislative Counsel's support in drafting appropriate language for consideration. So with those comments as background, I'd like to simply share the document that I understand has been shared with some council delegates. We will make sure, Ms. Bobroff, that you have a copy of this, that Ms. Vicente has a copy of this for distribution to this committee and ultimately however far we go. So just reviewing the Diné College, Department of Diné Education and NTU, along with some ETC, third-party eligible telecommunications carriers, have concerns on 257-21. We believe that there should be some amendments made on behalf of the Navajo people to better serve their broadband needs. As we know, 025721 is proposed to allocate $1.16 billion of ARPA fiscal recovery funds. 70% of the broadband section, or $145 million, the total broadband section is $208 million, 145 of which is being allocated to NTUA for the entire Navajo Nation. This is a key critical broadband funding opportunity. These reasons to amend are offered just as background for your consideration. Without meaningful review and input to the council, the ARPA funds proposed haven't been given sufficient in-depth solutions. NTUA, we believe, is operating from their perspective in the best interests of the nation, but they are looking at that as very specific, deliverable oriented, and the projects do not necessarily seek long-term solution such as ownership of assets or generation of revenue in return for this commitment. So $145 million is effectively going to NTUA as spending with no commitment for any return to the nation. There's little to no oversight in the regulation on NTUA because the Navajo Nation Telecommunications Regulatory Commission and Nntrc does not have oversight of NTUA's projects. We believe that NTUA is given the authority to serve as the ARPA broadband project evaluation. $45 million of the $145 million is for grants to third parties, and we will make a recommendation on changes to that shortly. As Ms. Thompson earlier stated, NTUA Wireless is majority owned by NTUA as an eligible telecommunications carrier and eligible for part of those $45 million, and there may be a conflict of interest if NTUA is the sole decider of grant allocations. We believe that the Nntrc and the Fiscal Recovery Fund Office are the best offices to provide the oversight of those funds. If the legislation passes as written, that $145 million goes to NTUA, but there are no prior commitments by NTUA in return to the Navajo Nation on bandwidth speeds, pricing, or service plans that are affordable or comparable or competitive to third parties. There is a dearth of competition, and NTUA can be seen as offering monopoly pricing, and there is no commitment necessarily to affordability for the Navajo people. Considering that all of NTUA's capital costs would be 100% funded, we believe that there is insufficient consideration to the Navajo people, especially around education. Also, as Ms. Thompson commented on the limits of consumer choice, we would like to see increased competition, certainly. NTUA effectively holding the pricing lever isn't necessarily compelled to offer competitive pricing services. And while some of the ETCs offer federal subsidies, such as the newly created Affordable Connectivity Program that gives $75 a month to tribal households for enrolled items, that we would like to see that supported by NTUA and NTUA Wireless, both entities. Other recommendations that we have at a high level: the Navajo Nation should set a process for collaboration and transparency and planning efforts for the next wave of any broadband plans. For this version of the legislation, Diné College and Navajo Technical University and the ETCs submitted project proposals as requested, but no feedback was given by the ARPA planning team, nor was there any subsequent participation in selecting, ranking, or coordinating efforts. So the transparency dimension is probably impaired more than it should be. Likewise, DOTI made broadband requests and have not received responses. We understand that the Navajo Council is put in the position per earlier legislation of simply approving projects that have been defined. We are only observing that the project definition process was arguably insufficient and not transparent enough. On behalf of DOTI, Diné College, and NTU, they are prepared to allocate resources to support future planning efforts to improve inputs and improve transparency. We believe that the Navajo Nation should be using GIS systems to map existing and proposed projects so that the council gets a visualization of where projects exist and where services will exist. To Ms. Thompson's comment earlier, construction is reported not to begin until 2025. This legislation does very little for education in the next few years. We believe that the Navajo Nation should allocate some of the broadband ARPA funding to fund its broadband office. We know that there is no legislation yet proposed to establish that, but maybe there should be some funding so that the nation can establish its own pool of technical project managers, administrators to manage projects or to hire skilled contractors. Project management should not be left entirely to third parties, even NTUA. Navajo Nation should be aware that ETCs, Diné College, and NTU, as well as DOTI, have their own grants management and program compliance functions. So it should not be taken at face value that NTUA is the only organization who can provide compliance with grants or federal funding dollars. And the Alliance of ETCs, DOTI, Diné College, and NTU could collaborate on a comprehensive plan that would more effectively meet the needs of the Navajo people, and they are prepared to work with a designated tribal office to develop that plan. So at a high level, I have 2 requested amendments on this document, and then I have one other brief page that I will share. We would like to amend section 4, propose that section 4 be amended to assign the grant allocation responsibility of the $45 million. And in the other document, I give specific citations, so that the evaluation, selection, and administration of all broadband expenditure plans go to the NDIT, Department of Information Technologies, under DGS, with the oversight of the FRF and the Nntrc. And that funding allocations should always be made on those $45 million through competitive grant solicitations. All grant offerings should be made through competitive funding opportunity announcements. If I may, I have one more simple document that I will share. Here we get to some specific recommendations regarding 257-21. First, I want to frame an assumption. In all cases, everyone believes that section 4B points 5 and 6 should remain in the legislation as written. Those sections are for public safety and rural addressing for $55 million and for cybersecurity for $8 million. We don't believe that those need to be changed. Here are 3 possible amendments to 257-21 for your consideration. 1, remove section 4B 1-2 from the legislation, returning in 4 to 6 months or a time mutually agreeable with a comprehensive plan for the benefit of the Navajo Nation under separate legislation. Those 2 items are totaling $100 million that go directly to NTU. You may choose to consider reserving a portion of that for the Navajo Nation for program oversight. And in that scenario of a 4 to 6 month working effort to come up with a project list, it would include Nntrc, the ETCs, the education community, as well as NTUA and joint planning. That's amendment option 1. Amendment option 2, section 4B points 3 and 4, revise the $45 million in grants that go to NTUA to instead be managed directly by the Navajo Nation and NDIT and Nntrc. You could reserve a small portion. This is very common in federal grants. Let's say 2.5% of that $45 million, which is $1.125 million, to NNTRT-DIT to handle the grants issuance, administration, and engagement of services or staff. And that would give the NNDIT the funding opportunity to be able to administer this program, as they have insufficient resources to take on more now. Amendment option 3, for the $100 million that go to NTUA, again, sections 4B points 1 and 2, before the funds are transferred, consider the nation and the council should consider negotiating pricing and affordability commitments. In this scenario, NTUA still gets all of the projects they're proposing under points 1 and 2, but they need to return something back to the nation. That could be pricing commitments, that could be bandwidth commitments, that could even be, as I cite in the optional, to negotiate an ownership stake in some portion of the assets and therefore create a recurring revenue stream from NTUA back to the Navajo Nation. And then the final recommendation, which I think Chair Tso touched on earlier, we would suggest that there be additional new legislation that would modify the NNTRC charter to include broadband oversight of services for NTUA wireless, and ETC. We do not believe that belongs in the broadband spending plan. That completes the review. I would be glad to answer any questions.
Thank you, Mr. Kurilla. Committee members, any questions?
Chair, this is Dana. Can I ask a question?
You certainly can, Ms. Barbara. You have the floor.
Thank you. I'm hoping that there is some written document that I could get a copy of that talks about what was just explained. I think that would be better with my notes. And so I guess that question is to the presenters. Is there a written document explaining your amendments you're requesting?
From my seat, Ms. Barbara, may I answer? Mr.
Go ahead,
Kurilla.
Mr. Kurilla.
Thank you very much, Chotso. Ms. Bobroff, these are the documents we have. As I mentioned earlier, we are not proposing any specific projects, but we would like, for instance, in the second document, to perhaps work with your office to draft possible legislative language for legislative amendment. We do not have a specific list of projects underneath these.
No, I'm not asking for a specific list of projects. What you just went through, and you said you should amend this section to say such and such. You should amend this section to say such and such. And so I'm asking if you have that written down anywhere.
I do not. These are the high-level recommendations for amendment. We would look to work with your office if we could to frame that in language acceptable to your office and the council generally.
Okay, it would be a great start if you could write it down. My office is one extraordinarily busy, and basically half of the office is out with COVID or the flu. Therefore, time is short, particularly since this legislation is to be in front of NABI tomorrow. So perhaps you can get me something written, I'm hoping, for later in the day, and then maybe we can do a call after hours. Will that work?
I could support that after hours, after 5 o'clock this evening.
Okay, that would be great. Send me contact info, please.
Chair, could I ask a question?
Go ahead, Honorable Vice Chair.
Thank you. Ms. Bobroff, after hearing the suggested concepts for revision, do you believe that those still need to go through a DOJ review? It's more, I guess, on the program administration side. And
that's kind of an interesting question. What it probably does is it probably changes all of the plans NTUA submitted. So, oh gosh, I don't know. Perhaps not, but there is the possibility. Just a reminder, everybody, we are dealing with federal funds. They are watching the nation really, really carefully, meaning the feds. So we're trying to make sure we do everything precisely right. So perhaps we don't need to amend expenditure plans, but I really need to take a look at the actual amendments they're proposing. So I can't say, actually.
Honorable Delegate Slater, Honorable So, may I have the floor?
Yes, you can, Mr. Corella.
I do believe that the DOJ should evaluate all project proposals. I think as Honorable Delegate Slater may be inferring from this presentation, we are not planning any project recommendations now, but I will take my best pass at certainly amendment. I'll add all 3 amendments. And again, I don't believe, we are well aware of the federal compliance obligations. I'm involved in TBCP and Reconnect grants and have experience with federal monies, as do the other education entities. So we appreciate the diligence and attention to detail on making a decision. I will send my best language, and I look for your input and review this evening, if you would, Ms. Bobroff, so we have something for the committee tomorrow.
Chair, can I add something?
Go ahead, Honorable Slater.
Thank you. I just spoke with Chris Vicente about some of this too, and so I think it'd be helpful if Mr. Krell, if you send that to Dana, Chris, myself, Chair, and then and Tom Platero as well, and then we'll figure out how to get the submission through the FRF DOJ office. And I hope it won't be that cumbersome of a review, because it's really just looking at sort of administration and oversight instead of the specifics of projects at this level. So
I expect that will be correct. And, you know, depending on the, for instance, in Amendment 1 that I shared in that second document, where we were looking for effectively a shot clock stopped for a couple of months while we come up with a more collective plan, that it coming out of that process would be a series of projects that need to be reviewed. For amendments 2 and 3, I think they're pretty straightforward for me to suggest language, subject to the team.
Okay, this is Dana again. I haven't received any documents whatsoever. I've requested a copy of your PowerPoint, but I haven't gotten it.
If I may, I will send them to the host of this meeting. And is that Angelita Benali? And I will ask her to forward them to you.
That would be great.
Thank you very much.
Okay.
Honorable Chair,
members, sorry. Committee members, are there any other questions, comments? There isn't, then Mr. Carrillo, you have follow-up?
I only wanted to say we appreciate the time of the committee today and the attention of both this committee and the entire Nntrc in just considering amendments as appropriate. We know that you discuss and discern the right steps for the nation, and I want to thank you on behalf of Dodie, certainly, and I expect from NTU and Diné College, regardless of the outcome. Thank you.
Thank you. Mr. Nelson, does that conclude the presentation?
Yes, good morning again, Chair So, Vice Chair Slater, and then also all the Health, Education, and Human Services Committee that are on the call. And also thankful for Mr. Corella and then also the team from the college and NTU. And yes, that does conclude our presentation, Chair So, regarding our proposed broadband amendments. to 0257-21. And again, we appreciate your support and look forward to positive outcomes and move forward from there. Thank you.
Thank you. Committee members, if you will allow, the chair would make some statements. I guess for me, we thought everybody was real good and happy campers as a result of the consortium that had presented to this committee as well as the Navajo committee. And then once the management plan, funds management plan were divulged, then I see the breakaway. But from day one, I've really emphasized the need for immediate connectivity. And what within this report, then some of that won't happen until 2025. In my most result, everybody knows that I've emphasized Starlink on day one. And on YouTube, there was that launch. And Starlink basically emphasized that the Cuba Independent Schools has paid for close to 700 systems, the Starlink systems, and 254 have been installed, 250 homes with students from Cuba Independent Schools within the Council Legislators, Star Lake, and Ojo Encino chapters have access to faster connectivity. And that's where I'm coming from when I basically criticize the aspects of the landlines, the fiber optics, the uplinks, and then going, and even the cell phone towers. Cell phone towers only reach within the line of sight, and it doesn't go over the hill in some aspects or across and through the sandstone capped mesas or the low arroyo valleys. We know that a lot of the homes are situated in those aspects. So and so that very limits the accessibility, it limits the connectivity. But when we have satellites where there can be unobstructed connectivity, then I saw that as the main basis for moving forward. And I'm really thankful that the Cuba Independent School District, Board of Education, as well as the superintendent and her staff have basically obligated pass-through monies from the New Mexico Public Education Department. It was funding that was made available to the school district from the former Indian Education Secretary, and that funding continues. And the Independent School District has obligated close to $1.4 million for subscription fees to Starlink for the next 2 years. And what we're continuing to basically seek funding is how to then, one, we reduce the subscription fees, and then how do we then make it available throughout the lifetime education for these young people. In some of the cases, 2 or 3 students are in one home. And what that does also is it allows multi-generational education initiatives. One Navajo school teacher asked permission from Torreon chapter if she could basically have her students help the parents and grandparents to either by phone or by computer Zoom into the chapter meetings. And in that aspect, it has really increased community involvement. It's led to multi-generational education. One of the findings from the work of the Cuba Independent School District is the parents who either dropped out or had to stop their educational process didn't have the skills to help their children or their grandchildren. And the teachers blessed them. They also helped the parents learn how to use the Chromebooks and the iPad to help their students, and as a result, they themselves are seeing the value of the education that they missed out on. And there is a continuing effort to for some of these parents to get their GED, and hopefully we enroll them in courses at Navajo Technical University or at Diné College. Those are some of the results that we see in the families that who send their students to the Cuba Independent School District. So there are many positive and beneficial results of the aspect of expanding the broadband services. And so I certainly, with this presentation, I think you have the support of the Health, Education, and Human Services Committee to move an amendment so that the educational entities, most especially the post-secondary educational entities serving the Navajo Nation, to include these two institutions. Thank you, Mr. Nelson, Ms. Thompson, Dr. Almerguy, Dr. Charles Russell, and the provost as well as Mr. Carrillo. Thank you. There are no other comments. Chair is open to a motion to accept the report.
I'll motion, Chair.
Second,
Alona.
The chair recognizes a motion by Honorable Vice Chair Slater and a second by Honorable Pernell Halona. Any follow-up comments and discussion?
Honorable
If not,
Honorable Jerzo, if I may,
yes.
I apologize. Ms. Bobroff, what is your email address? I'm about to hit send on these documents.
Ms. Bobroff?
Thank you. It's Dana Bobroff at Navajo -nsn.gov.
Thank you very much.
Chair, I have one bit of information you might find interesting, and that is that if everything is approved that's currently in 0257, with of course taking out the hardship, because hardship's already been appropriated, there will be a remaining balance in the FRS of about 110 million. And I will be sending out a chart on that soon. Thank you, Chair. Thank you, Committee.
Thank you, Ms. Bobroff. Any further comments? Okay, Mr. Mose, roll call vote, please.
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. Honorable Pernell Halona.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
One votes green.
Honorable Pernell Halona votes green. Honorable Carl Russell Slater.
Delegate Slater, green.
Honorable Carl Russell Slater votes green. Honorable Charlene So.
Hope, green.
Green.
Honorable Charlene So votes green. Honorable Edison J. Winika.
Green.
Edison J. Winika votes green. Chair, you have a vote of 5 in favor, 0 opposed.
Oh, thank you. Committee members, let the record show a vote of 5 in favor, 0 opposed, and the chair not voting. And thank you. That brings us to item number 6. Old business, there being none. New business, there being none. We go to item number 8, adjournment. As part of that is the announcements. Committee members, what's the wishes? The one thing, okay. I think we deferred all other items to next Wednesday's meeting, the 19th. Any other announcements?
I'll motion to adjourn.
If not, motion by Honorable Honorable Vice Chair Slater.
Second,
Juanica.
Delegate Paul Begay.
Second by Honorable Edison Juanica. Motion to adjourn entails no debate. Roll call vote, please.
Yes, sir. Honorable Paul Begay Jr.
Green.
Paul Begay Jr. votes green. Honorable Pernell Halona.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Juanica.
Green.
Honorable Edison J. Juanica votes green. Chair, I vote of 5 in favor, 0 opposed, adjourned at 12:17 p.m.
Thank you, Mr. Mose. Vote of 5 in favor, 0 opposed, the chair not voting. Committee members, stay safe, safe travels, and we'll see you at the next teleconference call, whether it be a work session or a committee meeting. With that, we are adjourned. Going that.